Cardiovascular diseases in the Western world are the leading cause of death and disability. This record is frightening, yet there are some important attitudes that we could implement in order to prevent this type of disease. Modifiable risk factors, being related to environmental conditions and personal habits, can change for the better. Cardiovascular diseases, risk factors. Some of the main risk factors for cardiovascular diseases are age, gender, genetic predisposition, weight and abdominal circumference, diet, sedentary lifestyle, blood pressure, smoking, presence of certain pathologies such as hypercholesterolemia or diabetes. Modifiable risk factors, such as weight and abdominal circumference, diet, sedentary lifestyle, smoking, blood pressure, have a significant impact on the health of the arteries. Take smoking, for example, which is the main cause of increased cardiovascular risk in people between 40 and 50 years old. Above 50 years old, however, the risk factor not to be underestimated is hypertension. They are both risk factors that the individual can intervene on, by changing their lifestyle and diet, or, if necessary, by taking specific medications. Checks are then fundamental. Hypertension may not give symptoms and hypertensive people are often unaware of it. How to keep blood pressure under control. The first thing to do is to reduce the amount of salt consumed at the table, not only by decreasing the added salt, but also by giving up foods that naturally or as a result of their preparation or preservation contain a lot of it. Some examples of salty foods may be cured meats, broth cubes, some industrial seasonings, beverages, jellies and sweets. It is also important to pay attention to bread, breadsticks, crackers and snacks, as they represent a significant addition of salts. Nutrition, tips for a healthy heart. Those who suffer from cardiovascular diseases should always consult a nutrition specialist, in order to have a clear understanding of the dietary regime suitable for their specific situation. In general, cardiovascular risk can be contained by increasing fish consumption, preferring vegetable fats and limiting animal fats, reducing the consumption of carbonated beverages and alcoholic drinks, consuming at least 4 to 5 servings of fruits and vegetables per day. Heart and physical activity. As far as physical activity is concerned, it is important to move regularly. One should start gradually, according to their level of training and respecting their own limits, and increase frequency and duration according to their own abilities. It is also important to emphasize that not everyone should behave in the same way. Those who have already had cardiovascular problems will have to carry out physical activity with greater attention, after agreeing it with their trusted specialist.